See, this is a section through the leg, section through the leg. This is fibula and this is tibia. This is interosseous membrane. So, posterior to this compartment is the posterior compartment of leg. Okay, this is anterior compartment and this one is lateral compartment. So, you can see in the posterior compartment lies this soleus, gastrocnemius and soleus in the most superficial plane. Along with it, plantaris. This can be absent supply, plantaris. Okay. Next, in the second plane, you will get these two muscles, flexor digitorum longus and flexor hallucis longus. Okay. Digitorum longus medially and hallucis longus laterally. Tendon of these two will cross near the sole of the foot. Next, deepermost is the tibialis posterior, which is taking origin from the interosseous membrane. So, in these three layers, muscles are lying, and these three layers are separated by this deep fascial sheets. Okay, this one is deep transverse fascial septum. Here is another septum, superficial transverse fascial septum. Okay, and in the intermediate plane, neurovascular bundles are present. Nerve of this compartment is tibial nerve and arteries are these two, posterior tibial artery and the peroneal artery. Okay. And in the superficial fossa, embedded within the superficial fossa, you will get this small saphenous vein, okay, in the middle of the cuff. And there is sural nerve. Sural nerve is cutaneous nerve. Sometimes sural communicating nerves is also visible. Sural nerve is branch from the tibial nerve. Sural communicating is branch of common peroneal nerve. Okay. So these are important landmarks in this posterior compartment. You can feel the common tendon of gastrocnemius and soleus, that is known as tendocalcaneus. Two malleoli you can feel, lateral and medial malleoli. Sustentaculum tali. Here is the sustentaculum tali, tuberosity of the navicular, and sometimes you can feel the posterior tibial artery pulsation can be felt against calcaneum about 2 centimeter below and behind the medial malleolus. Okay. Sustentaculum tali is discussed during the foot. It is a part of the calcaneum. Can be palpated a thumb breadth below the medial malleolus. Medial extension of the calcaneum. So next, you will see the superficial fossa. After the reflection of skin, you will get the superficial fossa. Loose connective tissue layer. In the superficial fossa of back of leg, it contains part of short saphenous vein and part of great saphenous vein. Very small part of great saphenous vein near the knee region and short saphenous vein near the middle of the cuff. Okay, and cutaneous nerve also you will see supplying these regions. So we'll discuss the short saphenous vein now. Short saphenous vein, also known as small saphenous vein, formed at the lateral border of the dorsum of the foot by the union of lateral end of dorsal venous arch and lateral dorsal digital vein. These two are joining to form the small saphenous vein. It enters the leg by passing behind the lateral malleolus and ascends upward lateral to the tendocalcaneus. And it further ascends along the midline of the calf and pierces the deep fossa in the lower part of the popliteal fossa. And finally, it opens into the popliteal vein. Okay, so this is the course of the small saphenous vein. See, this is the small saphenous vein originating on the lateral aspect, then ascending upward. Here it is piercing the deep fossa and draining into the popliteal vein. And these are the cutaneous nerve. You can see medial cutaneous nerve of thigh, posterior cutaneous nerve of thigh. This one is sural communicating nerve, lateral cutaneous nerve of the calf, and these are the branches of the saphenous nerve. Okay, so All these are cutaneous nerve. And near the knee on the medial aspect, you can get a small part of the great saphenous vein or long saphenous vein. Okay. In the lower part also it is lying anteriorly. In the upper part also it is lying anteriorly. Okay. Okay, so what are the tributaries of the small saphenous vein? Medial end of dorsal venous arch and the lateral dorsal digital vein. Okay, these are the two main tributaries. And the short saphenous vein is accompanied by the sural nerve, cutaneous nerve. Vein is vein of Giacometti. It is a communicating vein between the great saphenous vein and short saphenous vein. Crosses the thigh posteromedially from the popliteal fossa to the upper part of the front of the thigh. And great saphenous vein is accompanied by the saphenous nerve. Okay. It is short saphenous accompanied by sural nerve or great saphenous vein accompanied by saphenous nerve. So, great saphenous vein is formed at the medial border of dorsum of the foot by the union of medial end of dorsal venous arch and medial marginal vein. And on the back of the leg, it is seen only on the posteromedial side of the knee. You have seen in the picture here, great saphenous vein, and this one is small saphenous vein. Next are the cutaneous nerves. The skin of the back of leg is supplied by these following nerves. First is saphenous nerve. This area is supplied by branches of the saphenous nerve. Next is posterior division of medial cutaneous nerve of thigh. Here, this part by medial cutaneous nerve of thigh. Posterior cutaneous nerve of thigh. Posterior cutaneous nerve of thigh. Sural nerve. Okay. So this one is the sural nerve. Then lateral cutaneous nerve of calf. Here is the lateral cutaneous nerve of calf. And sural communicating nerve. Here is the sural communicating nerve. And a medial calcaneal branch of the tibial nerve. Here, medial calcaneal branch of tibial nerve. So saphenous nerve, its root value is L3, L4 and it is a branch of posterior division of femoral nerve. You have got during the femoral triangle and it accompanies the saphenous vein, great saphenous vein. And what is the distribution? It gives branch to the subsartorial plexus which was forming the roof of the adductor canal, subsartorial plexus, and gives infrapatellar branch and other cutaneous branch to the skin of the front and medial side of the leg and the medial border of the foot up to the ball of the big toe, ball of the great toe. Okay. So this is the supply of the saphenous nerve. Next, posterior division of medial cutaneous nerve of thigh supplies skin of the anterolateral side of the thigh and uppermost part of the medial 1/3 of the calf. Okay, here. Next, posterior cutaneous nerve of thigh. This is the supplying areas. Okay, here this one is saphenous nerve, sural nerve, medial calcaneal nerve, posterior cutaneous nerve of thigh, medial cutaneous nerve of thigh, lateral cutaneous nerve of thigh. Okay, so posterior cutaneous nerve of thigh root value is S1, S2, S3 here, and it pierces the deep fossa in the middle of the popliteal fossa and descends along with short saphenous vein. What is the distribution? It supplies a part of gluteal region, upper and medial side of thigh, main part of the back of thigh and upper half of the intermediate area of the calf. Next is sural nerve. This is sural nerve. L5, S1, S2. Sura means calf in Latin and it is a branch of tibial nerve and arises in the popliteal fossa, descends between two heads of gastrocnemius, pierces the deep fossa, accompanies the short saphenous vein and joined by the communicating nerve, sural communicating nerve, that is coming from common peroneal nerve in the upper part of the calf and passes behind the lateral malleolus and then runs forward along the lateral border of the foot. So this bluish colored area supplied by the sural nerve. And distribution supplies skin of the lower part of back of leg, lateral border of foot and the little toe. Okay. Next is lateral cutaneous nerve of cuff. It is a branch of common peroneal nerve, begins in the popliteal fossa. Here, lateral cutaneous, like dekhaini. Okay, so it supplies the skin of the upper 2/3 of the lateral side of the leg. Next is sural or sural communicating nerve or peroneal communicating nerve. L5 S1 S2, it is a branch of common peroneal nerve, begins in the popliteal fossa, pierces the deep fossa, joins the sural nerve on the back of the cuff, and distribution supplies the skin of the posteromedial part of lateral aspect of the cuff. Next is medial calcaneal branches here. Its root value is S1 and S2, and this is of tibial nerve, supply the branch from the tibial nerve, supply the skin of the heel. You can see here, skin of the heel and medial side of the sole of the foot. Lateral side was supplied by the sural nerve, medial side supplied by this medial calcaneal branch, okay, of the tibial. Now some clinical aspect we will discuss. First is sural nerve block, useful for anesthetization of the foot and lower leg. Okay, and sural nerve grafting. Sural nerve is the most commonly used for nerve graft because sural nerve is thick and long, purely sensory nerve. Hence, there is no motor loss and easily accessible in the superficial fossa. Okay, and sural nerve neuroma. Sural nerve may form painful neuroma. Neuroma is a tumor formation over the nerve. So neuroma, pinched nerve, is a tumor of the nerve tissue. Next we are going to the boundaries of the posterior compartment of legs. So we have completed the superficial fossa and the structures within it. Okay. So boundaries, the posterior compartment is bounded anteriorly by the posterior surface of tibia, interosseous membrane, fibula and posterior intermuscular septum. And posteriorly, it is bounded by deep fossa of the leg extending from subcutaneous surface of tibia to the posterior intermuscular septum. And these are the subdivisions. The deep fossa of the leg divides the posterior compartment into three parts. You have seen in those previous picture, superficial, middle and deep by two transverse fascial septa. Superficial transverse septum and deep transverse septum. Superficial transverse septum separates the superficial and middle parts and it is attached to the soleal line of tibia, medial border of tibia and posterior border of fibula. And the deep septum separates the middle and deep compartment of posterior compartment of leg and attached to the vertical ridge on the posterior surface of tibia and medial crest of the fibula. Okay. And what are the contents of these three parts? Superficial part contains Gastrocnemius, Soleus and Plantaris. Middle part contains flexor digitorum longus, flexor hallucis longus and posterior tibial nerve and vessels. And deep part contains the tibialis posterior. Okay. And all these structures can be given in your OSPI question. These nerve, vessels, muscles, mainly the muscles are given in your OSPI question. You have to identify the muscle, vessel or nerve and questions will be asked. 2 to 3 marks questions will be asked, related questions. Root value, its the branch of which nerve, how it terminates, supplying area, all this can be asked. Okay. Next, we are going to flexor retinaculum of the foot. Flexor retinaculum of the foot is also known as laciniate ligament or internal annular ligament. It is a thick band of deep fossa on the medial side of the ankle and that holds the long flexor tendons of the ankle in position. Width is about 2.5 cm. What is the attachments? Attached to these following structures. Anteriorly above to the posterior border and tip of the medial malleolus and posteriorly or below attached to the medial process of the calcaneal tuberosity. What are the structures passing deep to the flexor retinaculum? are these. Okay, tendon of tibialis posterior, then tendon of flexor digitorum longus, posterior tibial artery, tibial nerve, and tendon of flexor hallucis longus. Okay, and all these structures occupies a separate compartment, and the long tendons are covered by the synovial sheath. Okay, so you can remember like this. These are the posterior relations of the lower end of tibia. Okay, you can remember from those mnemonic টিকটিকি ডিম ভেঙে আমি ভাই নাকাল হলাম. ভেঙে আমি ভাই is this posterior tibial artery with veiny comitantes on the two sides. Okay, so here are the structures. Tibialis posterior, flexor digitorum longus, posterior tibial artery. This is the tibial nerve, flexor hallucis longus. Okay, and this is the flexor retinaculum, attaching the calcaneum with the medial malleolus. Okay, understood? And here these tendons are going in the sole of the foot, and these vessels and nerves are also going into the sole of the foot. These arteries dividing into two branches, medial and lateral plantar arteries, and nerve is also dividing into medial and lateral plantar nerves. Okay, so these are content of the foot. You can remember this content. You practice, you can practice a schematic diagram like this. Okay, okay, so we will see these muscles of back of leg divided into two groups by transverse intermuscular septum. Superficial group contains gastrocnemius, soleus, plantaris. Deep muscles include this: Popliteus, flexor digitorum longus, flexor hallucis longus, and tibialis posterior. These are the deep muscles. Okay, so you have to know the origin, insertion, nerve supply, action of all these muscles. Okay, so the superficial muscles of back of the leg are gastrocnemius, soleus, and plantaris, and these muscles form the bulk of calf. See, this bulk of calf is formed by the gastrocnemius and soleus mainly. And this is an indicator of upright stance and bipedal locomotion. Okay, and these together, this gastrocnemius and soleus is together called Triceps Surae. This term is very frequently asked in your viva question. What is Triceps Surae? Another term you got is tricipital tendon. Which muscles was forming this tricipital tendon? No, no. This is Triceps Surae. Tricipital tendon I am asking. In the gluteal region. It was located in the gluteal region. Which muscles were forming this? I have discussed multiple times. Yes, superior gemelli, inferior gemelli, and tendon of obturator internus. Yes, these three are together forming the tricipital tendon. And here is triceps surae, two heads of gastrocnemius and soleus. Okay. So gastrocnemius is a large bulky muscle. Here gastrocnemius have been shown. These are the two heads of origin. Here is the insertion. Okay. It is a large bulky muscle of the calf. Gaster means belly or stomach, and chemem is leg in Latin and Greek. So where is the origin? Origins from two heads, medial and lateral head. Medial head is larger than the lateral head, arises by a broad flat tendon from the posterior superior aspect of medial condyle of the femur. Here is the medial head, here is the lateral head. Posterior inferior surface of medial condyle behind the adductor tubercle. An adjoining part of the posterior surface of septa of femur. And lateral head is smaller and arises by a broad flat tendon from the lateral surface of lateral condyle of femur here and lateral supracondylar line. And few fibers of both the heads arise from adjoining part of capsule of the knee joint. Okay. What are the direction of fibers? The fibers of both the ends descend and converge in the midline of the leg to form a thin, broad aponeurotic tendon. You can see the tendon is very thick and narrower. And this tendon fuses with the tendon of the soleus in the middle of the leg to form the Tendoachilles or Tendocalcaneus. Okay. What is the insertion? Tendocalcaneus. This is very frequently given OSPE. Gastrocnemius, very large muscle. So, Tendocalcaneus is the calcaneal tendon inserts on the middle 1/3 of posterior surface of the calcaneum here. This is the insertion, you can see. Middle 1/3 of posterior surface of calcaneum. Upper 1/3 and lower 1/3 is free. Innervation is by tibial nerve. These are the actions. Gastrocnemius and Soleus together perform these following actions. Flexion of the foot at the ankle joint, and gastrocnemius alone produces flexion at the knee joint. Okay. And clinical testing, how will you test the muscle? Ask for plantar flexion against resistance in supine position with extended knee and feel the contracting muscle. Okay. That's how you test this gastrocnemius. See, this is posterior view gastrocnemius, and deep to it here is the soleus, and this one is plantaris muscle. Okay, very thin muscle, sometimes absent. It lies along with the lateral head of gastrocnemius, and this tendon is inserted medial to the tendocalcaneum. Okay. So gastrocnemius originates by two heads, medial head from medial condyle of femur, lateral head, lateral condyle and lateral supracondylar line of femur, insertion through tendocalcaneus at middle 1/3 of posterior surface of calcaneum, innervation tibial nerve, action plantar flexion at ankle joint, flexion of knee joint. And this is the clinical aspect. Ask for plantar flexion against resistance. How you will feel the muscle. Next is tendocalcaneus, also known as calcaneal tendon, also called Tendoachilles or heel cord. It is a common tendon of gastrocnemius and soleus, and tendons of this muscle fuse in the middle of the calf to form the calcaneal tendon. Length is about 15 cm. Insertion middle area of posterior surface of calcaneum. Achilles, according to the Greek mythology, was an irresistible and invincible warrior. There is a history. Okay, so he was held by his mother when she dipped him in the holy river Styx to make him invulnerable. But eventually he was killed in a war by an arrow hitting his vulnerable heel. Okay, that was not dipped in the river water, and which was not protected by holy river water, and hence the calcaneal tendon was called Achilles tendon. Okay, this name has come from this story, tendocalcaneum or tendoachilles. Okay. Next, another clinical aspects are tennis leg. The overstretching of the medial head of gastrocnemius in tennis players result in tear of myotendinous junction of the medial head of gastrocnemius, and it results in calf pain and called tennis leg. Next is Achilles tendon tendonitis. It involves pain due to thickening of the calcaneal tendon at its insertion, and it occurs due to the calcaneal tendon at its insertion, occurs due to repetitive strain of the muscle. Okay, that is Achilles tendon tendonitis. And Achilles tendon rupture mostly occurs in people playing recreational sports and may be complete or partial tear or loss of plantar flexion of the foot. Okay. Next is, and this is calcaneal tendon reflex. Okay, here the hammer is tapped over the tendocalcaneus and there will be reflex plantiflexion in normal reflex. S1, S2 spinal segments are tested like this. So retrocalcaneal bursitis, it is the most common heel bursitis. It is an inflammation of bursa located between the calcaneus and calcaneal tendon. And calcaneal tendon reflex, it is also known as ankle jerk reflex or triceps surae reflex. You have to perform this reflex in your final year, okay? And also in physiology also you will get this tendon reflexes you have to learn, okay? So ankle jerk reflex or triceps surae reflex, it is a myotatic reflex elicited while the person's legs are dangling over the side of the examining table and the calcaneal tendon is struck briskly with a reflex hammer just proximal to the calcaneus, and normal reflex is plantiflexion of the ankle joint, and the calcaneal tendon reflex tests the S1 and S2 nerve roots, and absence of the ankle reflex occurs in S1 nerve root injury. Okay. Next we are going to soleus. Soleus is also important muscle. It is sole sepid, okay, and immediately deep or anterior to the gastrocnemius it lies. What is the origin? It has horseshoe sepid origin from these following structures: posterior surface of head and upper 1/4 of the posterior surface of shaft of fibula, the soleal line and middle 1/3 of medial border of the shaft, and tendinous arches between tibia and fibula. Okay, soleal shaft of the tibia. And what is the direction of fibers? The muscle fibers pass obliquely to insert on flat tendon, and that joins with the tendon of gastrocnemius in the middle of the calf to form the calcaneal tendon. Insertion: calcaneal tendon inserts on the middle part of posterior surface of the calcaneum along with the gastrocnemius. Innervation by tibial nerve acts as plantar flexion of the ankle joint, same as gastrocnemius. Gastrocnemius, soleus, plantaris. Okay. Here gastrocnemius have been cut to show the soleus present deep to it. Okay. And here lies the tendon of the plantaris. Okay. Here is insertion of the plantaris. Here is the tendocalcaneum. And these are the origin of plantaris and these are the origins of the soleus. Okay. Soleal line and here from the fibula also. So soleus origin from the posterior surface of head and upper 1/4 of posterior surface of fibula and soleal line of tibia. And insertion middle 1/3 of posterior surface of calcaneum through tendocalcaneus, nerve supply by tibial nerve, action plantar flexion at the ankle joint. Next, there are some clinical aspects involved with soleus. This is comes in your theory. What is peripheral heart? What is its function? The soleal muscle acts as the peripheral heart. Okay. So the soleus and gastrocnemius act together as strong plantar flexion of the ankle joint. And what is peripheral heart? Large valveless venous sinuses are located in the substance of soleus and gastrocnemius. You can see this is venous sinus. Okay, these are the valves. Okay, so on contraction, these muscles pumped out the blood and helped in venous return from the lower limb towards the heart. Okay, during contraction of this calf muscle, it pushes the blood upward, anti-gravity action. Hence, specially soleus is called peripheral heart. Okay. Role of bottom gear and top gear. Soleus muscle is the bottom gear as it mostly helps in standing with continuous state. Okay, during walking and running it is gear, and gastrocnemius is top gear that provides force behind propulsion for walking, running, or jumping. And soleus muscle contain type 1 slow rate fatigue resistant muscle fibers and that are suitable for continuous contraction during standing. Hence, soleus is considered as workhorse of the plantar flexion. And gastrocnemius contains type 3 fibers, fast twitch white fiber. Okay, and these fibers that are suitable for propulsive action, so helps in running, jumping, and fast walking. Okay. These are some clinical aspects. Soleal tear, overuse of soleus muscle in athletes may result in soleal tear. Treatment include RICE method: rest, icing, compression, and elevation. Okay. And soleal pain. Overuse of soleus muscle may cause soleal pain. typically occurs as pain onset in the beginning of the exercise and decreases with time. Calf pain and deep venous thrombosis. Sudden onset of calf pain may occur due to deep vein thrombosis. In patients, in after operations, there is high chance of deep vein thrombosis because locomotion is lost. Deep veins, this calf muscle is not contracting because patient is lying continuously on the bed, no movement of the lower limbs. So sudden onset of calf pain and may occur due to deep vein thrombosis, and which is a medical emergency due to risk of pulmonary embolism. Okay, the embolism formed in the deep veins that will reach the heart, and from there it will go to the pulmonary circulation. The very fine vessels are present there in the pulmonary circulation, so there is high chance of pulmonary embolism. Okay, there will be loss of blood supply, loss of gaseous exchange, and other things will occur. Okay, so this is emergency condition, deep vein thrombosis. Next we are going to plantaris. It is a long thin muscle. It has a, so you prepare this peripheral heart, soleus, okay, as you explain why or short note. Okay, and plantaris is a long thin muscle and it has a short belly and a long tendon, and hence considered as a vestigial muscle in the human being. Originates from lower one third of lateral suprachondral line of femur and the adjoining part of oblique popliteal ligament. Next, what is the direction of fibers? The fibers of plantaris muscle are short and form a 7 to 10 centimeter long fusiform belly, and they form a long tendon runs between the gastrocnemius and soleus from lateral to medial side, inserts on the posterior surface of the calcanea just medial to the calcaneal tendon, tendocalcaneus. This you remembered. Insertion is just medial to the tendocalcaneus. Innervation tibial nerve, action rudimentary muscle, so it does not act separately but acts with the gastrocnemius, helps in plantarflexion. So here you can see the plantaris originating from lateral supracondylar line of femur, inserts on the medial to the tendocalcaneus. Okay. Here is the tendocalcaneus and here is the plantaris, insertion of plantaris. Plantaris is the vestigial muscle origin from the lateral supracondylar line of femur, insertion into the posterior surface of the calcaneum medial to the tendocalcaneus, innervation by the tibial nerve, action is supports the gastrocnemius. Okay. These are some clinical aspects. Plantaris is absent in about 10% of population. Okay, and plantar aponeurosis is a degenerated tendon of the plantaris. Fresherman's nerve, the tendon of plantaris, it resembles like a nerve and it is mistakenly considered as the tibial nerve by Fraser surgeon or students, and hence it is called Fresherman's nerve. Okay. Tendon grafting. Plantaris tendon can be used for grafting in reconstructive surgeries of the tendons of the hand. Okay, very thin tendon and does not perform any major function in the lower limb. That's why it is used as a grafting. Next, we are going to deep muscles of the back of leg. The deep muscles of back of leg are Popliteus. Here is the Popliteus. Flexor digitorum longus, flexor hallucis longus, and tibialis posterior. Popliteus is a small triangular flat muscle and forms a part of floor of the popliteal fossa. Where is the origin? Here is the origin. Popliteal groove on the lateral surface of lateral condyle of femur here. Popliteus muscle origin is intracapsular but extrasynovial. Okay, and it originates from anterior part of the popliteal groove that is located on the lateral surface of lateral condyle of femur. This point you remember. This is asked in your viva. bones viva. Okay, where is the origin of popliteus muscle? Anterior part of popliteal groove located on lateral surface of lateral condyle of the femur, and arcuate popliteal ligament and outer margin of lateral meniscus. And what is the direction of fiber? This is the muscle. Here is the origin, here is the insertion. Okay, insertion into medial 2/3 of triangular area above the soleal line. The fibers of popliteus spread out to form a flat triangular muscle, and which forms the floor of the popliteal fossa. Okay. Insertion, popliteus inserts on the medial 2/3 of the triangular area above the soleal line on the posterior surface of the tibia and the popliteal fossa. Innervation is by tibial nerve. And what is the action? Action is unlocking of the knee. Popliteus rotates the femur laterally on the tibia in the beginning of flexion of the knee joint, and hence this muscle unlocks the joint. Okay, unlocks the knee joint. And popliteus pulls the lateral meniscus during the lateral rotation of femur and prevents or protects it from getting trapped. Okay, and helps in flexion of the knee joint. So these are the function of the popliteus muscle. This muscle is mainly important for your theory and viva. Okay. So popliteus origin from popliteal groove at the lateral surface of lateral condyle of femur. Insertion into the triangular area above the soleal line of tibia. Innervation is by tibial nerve. Action is unlocking of the knee and flexion of the knee joint. These are some facts. Popliteus is the key muscle that unlocks the knee joint during knee flexion. Okay, unlocking muscles of knee. And posterior part of popliteal groove is occupied by the tendon of popliteus during full flexion. And popliteus rotates the tibia medially when the foot is off the ground. And nerve to popliteus is a branch of tibial nerve and winds around the lower border of the popliteus muscle, supplies the muscle from its deeper aspect. Okay, that is anterior aspect of the muscle. Next we are going to the flexor digitorum longus. This is flexor digitorum longus, going to dividing into 4 tendons going towards the lateral 4 toes. Okay, so here is the origin. Upper 2/3 of medial part of posterior surface of tibia below soleal line. So flexor digitorum longus is thin muscle and that lies under cover of soleus and gastrocnemius. And here is the origin. Originates from upper 2/3 of the medial part of posterior surface of tibia below the soleal line. And this is direction of fibers. The fibers descend downward and give rise to a tendon a few centimeters above the ankle joint. And this tendon of flexor digitorum longus runs behind the medial malleolus. Here runs behind the medial malleolus. Deep to the flexor retinaculum. Okay, and then the tendon enters the plantar aspect of the foot and divides into 4 smaller tendons for 4 lateral toes. Next, insertion. The tendon of flexor digitorum longus divides into 4 small tendons, each one of which is inserted on plantar surface of base of the distal phalanx. Here, inserted over the distal phalanx of the corresponding lateral 4 toes. Innervation is by the tibial nerve, and these are the actions. Flexor digitorum longus performs the following action: plantar flexion of the lateral 4 toes, plantar flexion of the ankle, and maintains the longitudinal arches of the foot. Here, this is flexor digitorum longus, and here is the flexor hallucis longus, originating from the fibula, some part of the tibia and the interosseous membrane, and going to insert into the distal phalanx of great toe. Okay, and here popliteus have been shown, and this is tibialis posterior. Okay, So we'll discuss this. Flexure digitorum longus, origin from upper 2/3 of medial part of posterior surface of tibia below the soleal line. Insertion divided into 4 tendon inserted on the plantar surface of base of distal phalanx of lateral 4 toes. Innervation tibial nerve. Action is plantar flexion of lateral 4 toes, plantar flexion of ankle, and maintain the longitudinal arches. The tendons of flexure digitorum longus in the foot receives the insertion of flexor digitorum accessorius. This is intrinsic muscles of the sole. Okay, and the action of flexor digitorum longus are important for walking cycle by maintaining the toes in firm contact with the ground. Next is flexor hallucis longus. This one is flexor hallucis longus. It is a powerful deep muscle of posterior compartment of leg, unipinnate muscle. Okay, it originates from lower 2/3 of posterior surface of septa of fibula behind the medial crest, adjoining part of interosseous membrane. And these fibers run obliquely downward and converge on a long tendon that passes behind the flexure retinaculum and runs in the sole of foot towards the great toe through the tarsal tunnel and below the sustentaculum tali, and inserted on the plantar surface of the base of the distal phalanx of great toe. Nerve supply is tibial nerve. Action, it performs the following actions: plantar flexion of great toe, plantar flexion of the ankle, maintains the medial longitudinal arch of the foot. Okay. So this is flexure hallucis longus. So it is origin from this lower 3/4 of posterior surface of fibula behind medial crest and interosseous membrane. Insertion base of distal phalanx of great toe, innervation tibial nerve. Action is plantiflexion of great toe and ankle and maintain the longitudinal arches. And tendon of flexor hallucis longus passes through the groove on the posterior surface of body of the talus and the groove in the inferior surface of the sustentaculum tali. These relations are important, okay, for sole. And tendon of flexor hallucis longus is crossed by the tendon of flexor digitorum longus at their entry in the sole of the foot. Okay. And this is one clinical aspect. Stenosynovitis of the flexor hallucis longus in ballet dancer is referred as dancer's tendinitis. In ballet dancer, this great toe is used mostly, okay, and it occurs due to extreme plantar flexion of the foot and which exerts stretching of the flexor hallucis longus. Okay, the dancer stands over the great toe and there will be massive plantiflexion of the foot. You have seen during the ballet dancing. Okay, so and the trigger is here, it has been shown. Dancer or runners overuse of flexor hallucis longus, there will be development of nodules in the tendon of flexor hallucis longus and inability to extend the toe. Next is trigger toe or hallux saltans. It involves development of noodles along the tendon of the flexor hallucis longus in dancers and runners who overuse the flexor hallucis longus, mainly nodule-like structures. Next is tibialis posterior. It is the deepest muscle of the posterior compartment of leg. Here is the originates from upper 2/3 of lateral part of posterior surface of tibia below soleal line, here from tibia, and posterior surface of septa of fibula in front of medial crest, here from the fibula, and adjoining posterior surface of the interosseous membrane. What is the direction of fibers? Fibers fuse, converge on the central tendon which runs downward through the groove behind the medial malleolus of the tibia, here behind the medial malleolus of tibia, and the tendon passes deep to the flexor retinaculum and enters in the sole of the foot, here. And the tendon of tibialis posterior divides into two divisions. The superficial division inserts on the tuberosity of the navicular bone. Okay, here tuberosity of the navicular, and smaller lateral part. This one is tuberosity of navicular, and this is lateral part going to the base of the metatarsal. Okay, smaller lateral division gives slits that insert on plantar surface of all tarsals except the talus and bases of the second to fourth metatarsals. Innervation is by tibial nerve and action. Tibialis posterior perform this action. Inversion of foot, plantar flexion of foot at the ankle joint, and it maintains the medial longitudinal arch of the foot. Okay, this is the function of tibialis posterior. Here is the tibialis posterior. Inserting over the tuberosity of navicular and base of these two metatarsals. So tibialis posterior origin from this upper 2/3 of lateral part of posterior surface of tibia below soleal line, posterior surface of fibula and the interosseous membrane. Insertion is over tuberosity of navicular, all the tarsals except the talus and bases of second to fourth metatarsals. Innervation is by tibial nerve. Actions is innervation of the foot, inversion of the foot. Inversion of the foot, it is lying on the medial side, so it will help in inversion of the foot. Plantar flexion of the foot, and it maintains the longitudinal arches. Next is the artery of this compartment, posterior tibial artery. Here, this one is the posterior tibial artery. Okay, this is one terminal branch of the popliteal artery. Popliteal artery is dividing into two branches, anterior tibial and posterior tibial. Anterior tibial is going to the anterior compartment and posterior tibial is lying in this posterior compartment. And peroneal artery, it is a branch of posterior tibial and it is going to the lateral compartment. Okay, so posterior tibial artery is main artery and it is terminal branch of popliteal artery, begin at lower border of popliteus in the popliteal fossa. This level is important where it arises, anterior and posterior tibial artery, lower border of popliteus muscle, asked in your viva and MCQs. Okay, and course it runs vertically downward under the tendinous arch of soleus to reach the posteromedial side of the ankle, and it runs midway between the medial malleolus and medial tubercle of the calcaneum under cover of the flexure retinaculum. And how it terminates? It terminates deep to the flexure retinaculum into medial and lateral plantar arteries. It divides into these two terminal branches. These are the relations, superficial and deep relation. Superficial relation in the upper part of leg lies deep to the gastrocnemius and soleus, and in the lower part of leg it runs on the medial side of tendocalcaneum under cover of skin and fossa, and at ankle it is covered by the flexure retinaculum and the abductor hallucis. And deep relation, posterior tibial artery related on deep to the following structure. Tibialis posterior in the upper part of leg, flexor digitorum longus and tibia in lower part of leg, and capsule of ankle joint deep to the flexor retina. Relations are not much important, and these are the branches. Peroneal artery, this is peroneal artery. Muscular branches which supplying the muscles of posterior compartment. Nutrient artery to tibia. Circumflex fibular branch, this is circumflex fibular branch taking part in genicular anastomosis. Medial malleolar branch here, lateral malleolar branch. Okay, medial malleolar branch, then medial calcaneal branch. Here is the medial calcaneal branch, medial plantar artery and lateral plantar artery. These two are the terminal branch, medial plantar, lateral plantar artery. And this lateral malleolar branch is coming from this peroneal artery. Okay. So posterior tibial artery begins as a terminal branch of popliteal artery at the lower border of popliteus muscle. Terminates by dividing into medial and lateral plantar arteries. And branches are these: peroneal artery, muscular branches, nutrient artery of tibia, circumflex fibular branch, communicating branch, medial and lateral malleolar branch, medial and lateral plantar branch. Circumflex fibular artery surrounds the lateral side of neck of fibula to reach the front of knee. Peroneal artery or fibular artery arises 2.5 cm distal from the posterior tibial artery as it is the largest branch, and peroneal artery descends along the medial aspect of fibula. Nutrient artery of tibia enters the tibia below the soleal line, and the communicating branch of posterior tibial artery anastomoses with the peroneal artery in the lower part of the leg. And medial malleolar branch turns anteriorly around the medial malleolus, and calcaneal branches perforate the flexure retinaculum and supply the soft tissue of the heel. So these are the course of its branches. This is one clinical aspect. The posterior tibial artery pulse, it can be felt at Pimenta's point here. Okay. That is located in the midpoint of the line joining the medial malleolus and the insertion of the calcaneal tendon. These 2 points, in between these 2 points, midpoint is the Pimenta's point. Here you can feel the posterior tibial artery, and it is about 2 cm below and behind the medial malleolus. Next is peroneal artery. It is also known as fibular artery, artery of lateral and posterior compartment of leg. Largest branch of posterior tibial you have seen begin 2.5 cm below the lower border of Popliteus, runs obliquely downward along the fibula between tibialis posterior and flexor hallucis longus under cover of Soleus, and divides into numerous terminal branches at the calcaneum. Branches are these: muscular branches, nutrient artery to fibula, perforating branch, posterior lateral malleolar branch, communicating branch for posterior tibial artery, and the calcaneal branches. The peroneal artery may be larger and may replace the posterior tibial artery, and perforating branches of the posterior tibial artery and the peroneal arteries reinforce the anterior tibial artery, and the calcaneal branches of fibular artery supply the soft tissue of the heel. Okay. Next we are going to the nerve. So we have discussed the vessels and the nerve. Nerve is the tibial nerve, is the longest terminal branch of the sciatic nerve. Root value is this: L4, L5, S1, S2, S3. We have already discussed it. Tibial nerve arises from sciatic nerve at the superior angle of the popliteal fossa, runs vertically downward up to the inferior angle of the popliteal fossa, and this is the course in the leg. It runs vertically downward in the undercover of tendinous arch of Soleus along with the posterior tibial vessels, and it follows the course of posterior tibial artery in the leg. This is the termination, terminates by dividing into medial and lateral plantar nerves deep to the flexure retinaculum. But these are the branches: muscular branches to tibialis posterior, flexor digitorum longus, flexor hallucis longus. Here, tibialis posterior, flexor digitorum longus, flexor hallucis longus, and deep part of the soleus. Cutaneous branch is medial calcaneal nerve, pierces the flexure retinaculum, supplies the skin over the heel. Articular branches to the ankle joint, and terminal branches are these two: medial and lateral plantar nerves. This is one clinical aspect: tarsal tunnel syndrome. It is a condition where the tibial nerve is compressed within the tarsal tunnel. Okay, and this may occur due to osteoarthritis or trauma and result in paresthesia of the ankle and the sole. Okay, that's all. So what will be the incision line for back of leg? You draw a horizontal incision at the junction of upper 1/4 and lower 3/4 of the leg. Okay, and second incision joining the two malleoli, medial and lateral malleoli. Then draw a vertical incision joining the midpoint of these two incisions. Here whole of the back is exposed. So upper incision is more above, also including the popliteal fossa. We are joining the two epicondyles of the femur. Okay, medial and lateral epicondyles of the femur. So after that, you reflect the skin flaps medially and laterally. In the superficial fossa, you can see the short saphenous vein. Okay, cutaneous nerve, if visible, I will show. Sural nerve, you can be visible sometimes. After that, after the superficial fossa, there is deep fossa of the leg. Okay, deep fossa is also reflected along the skin incision, and then you will go reach the muscle. First, you will see the gastrocnemius, then plantaris and soleus.